Depression in women, 5 things you should know. Being sad is a normal reaction to difficult times in life. But usually, the sadness goes away with a little time. Depression is different. It is a mood disorder that may cause severe symptoms that can affect how you feel, think, and handle daily activities such as sleeping, eating, or working. Depression is more common among women than men, likely due to certain biological, hormonal, and social factors that are unique to women. This video contains an overview of 5 things that everyone should know about depression in women. 1. Depression is a real medical condition. Depression is a common but serious mood disorder. Depression symptoms can interfere with your ability to work, sleep, study, eat, and enjoy your life. Although researchers are still studying the causes of depression, current research suggests that depression is caused by a combination of genetic, biological, environmental, and psychological factors. Most people with depression need treatment to feel better. Depression is not a sign of a person's weakness or a character flaw. The truth is that most people who experience depression need treatment to get better. If you are a friend or family member of a woman with depression, you can offer emotional support, understanding, patience, and encouragement. Most people with depression need treatment to feel better. If you think you may have depression, start by making an appointment to see your healthcare provider. This could be your primary doctor or a health provider who specializes in diagnosing and treating mental health conditions, for example, a psychologist or psychiatrist. Certain medications, and some medical conditions, such as viruses or a thyroid disorder, can cause the same symptoms as depression. A healthcare provider can rule out these possibilities by doing a physical exam, interview, and lab tests. Your healthcare provider will examine you and talk to you about treatment options and next steps. Talking to your healthcare provider about your mental health. Communicating well with your healthcare provider can improve your care and help you both make good choices about your health. 2. Depression can hurt, literally. Sadness is only a small part of depression. Some people with depression do not feel sadness at all. A person with depression also may experience many physical symptoms, such as aches or pains, headaches, cramps, or digestive problems. Someone with depression also may have trouble with sleeping, waking up in the morning, and feeling tired. If you have been experiencing any of the following signs and symptoms for at least 2 weeks, you may be suffering from depression. Persistent sad, anxious, or empty mood. Feelings of hopelessness or pessimism. Irritability. Feelings of guilt, worthlessness, or helplessness. Decreased energy or fatigue. Difficulty sleeping, early morning awakening, or oversleeping. Loss of interest or pleasure in hobbies and activities. Moving or talking more slowly. Feeling restless or having trouble sitting still. Difficulty concentrating, remembering, or making decisions. Changes in appetite or weight. Thoughts of death or suicide attempts. Aches or pains, headaches, cramps, or digestive problems without a clear physical cause that do not ease even with treatment. 3. Certain types of depression are unique to women. Pregnancy, the postpartum period, perimenopause, and the menstrual cycle are all associated with dramatic physical and hormonal changes. Certain types of depression can occur at different stages of a woman's life. Premenstrual dysphoric disorder, PMDD. Premenstrual syndrome, or PMS, refers to moodiness and irritability in the weeks before menstruation. It is quite common, and the symptoms are usually mild. But there is a less common, more severe form of PMS called premenstrual dysphoric disorder, PMDD. PMDD is a serious condition with disabling symptoms such as irritability, anger, depressed mood, sadness, suicidal thoughts, appetite changes, bloating, breast tenderness, and joint or muscle pain. Perinatal depression. Perinatal depression is a mood disorder that can affect women during pregnancy and after childbirth, and is much more serious than the baby blues. The word perinatal refers to the time before and after the birth of a child. Perinatal depression includes depression that begins during pregnancy, called prenatal depression, and depression that begins after the baby is born, called postpartum depression. Mothers with perinatal depression experience feelings of extreme sadness, anxiety, and fatigue that may make it difficult for them to carry out daily tasks, including caring for themselves, their new child, or others. Perimenopausal depression. Perimenopause, the transition into menopause, is a normal phase in a woman's life that can sometimes be challenging. If you are going through perimenopause, you might be experiencing abnormal periods, problems sleeping, mood swings, and hot flashes. Although these symptoms are common, feeling depressed is not. If you are struggling with irritability, anxiety, sadness, or loss of enjoyment at the time of the menopause transition, you may be experiencing perimenopausal depression. Depression affects each woman differently. Not every woman who is depressed experiences every symptom. Some women experience only a few symptoms. Others have many. The severity and frequency of symptoms, and how long they last, will vary depending on the individual and the severity of the illness. 4. Depression can be treated. Even the most severe cases of depression can be treated. Depression is commonly treated with medication, psychotherapy, also called talk therapy, or a combination of the two. Antidepressants are medications commonly used to treat depression. People respond differently to antidepressants, and you may need to try different medicines to find the one that works best. Depression affects each individual differently. There is no one-size-fits-all for treatment. 5. Researchers at the National Institute of Mental Health, NIM, and across the country are dedicated to women's mental health research. Researchers continue to study depression to improve the way this medical condition is diagnosed and treated. For example, NIM researchers are currently working to understand how and why changes in reproductive hormones trigger mood disorders, including postpartum depression, premenstrual dysphoric disorder, and perimenopausal depression.